Hi, I'm Dr. Mark King from the Motion Palpation Institute. I'm just showing a little quick demo of a routine office visit of a patient that I've adjusted times before. Actually, Dr. Kowalski is a chiropractor, and so I've worked on her before, but this would be a typical scenario. Now, I've kind of done some of this already for brevity, but I wanted to get you to get the idea of what I would do. I would start with a normal seated scan and try and find areas that feel restricted, and then I can go right into my treatment from there. Notice that I go way up into the cervical spine and then come all the way down to about T4 when I do the CT area, and I can then start to localize. I feel a little on the left first rib. T2 on the right here is restricted. When I go in and check extension in the thoracolumbar junction, she has that. So she's got some kind of typical things that a chiropractor might have from working on patients all the time. A little loss of extension at the sacroiliac joint on the right, on the left not so much. So I can go right into my adjustments from here. I can start in a number of ways. I think today I'll just start with the sacroiliac joint, adjust that, and then do the thoracolumbar area, and then come back and recheck and do the CT junction. So I'll bring her over to this table on your right side. So I'm going to contact the right sacrum with the involved side down. Make sure that it's always nice if the patient knows how to set themselves up, which is not typical. But I'm going to roll the patient into me here, and I'm going to body drop here, and then I'm going to have her just roll right into the supine position with the knees bent. Give herself a hug. Drop her head back a little bit, and I'm just going to come in for a loss of extension at the thoracolumbar junction here. And then tell her to roll onto her side, and then come on up, and then come back over here. We'll recheck this, and then do the CT junction. So I go right in and check that loss of extension, which is better at the sacroiliac joint. Most chiropractors need the thoracolumbar junction adjusted because we're bending over patients all the time. And I have this CT junction that I want to adjust next. Now the left first rib feels a little better after these other adjustments, but that CT junction on the right is still a problem. So I'll go right into that. I'll get a spinous contact with my finger and a little bit of the facet because I'm doing a combination for loss of extension and lateral flexion. And then I can go right back in and check again. She's got a little bit of tightness on this left first rib, not a true fixation. Feel a little stretch there. Get a little stretch on the scalenes and see if it's just a little bit of tight scalenes. Because I know this patient, I know that she tends to get tight in her iliofemoral joint, so I can go right in and check that. Yeah, that's kind of what I would call a fake fixation at that left first rib. So if you go supine on this table, I'm going to just get a little more mobility in the iliofemoral joints for the posterior capsule. So I can go here, am I pinching in there? And go right into the posterior capsule of the iliofemoral joint. You okay, pinch? And then if I want to, I can go into a little PIR stretch. You feel a stretch there?